Hello, I'm Indira Giri. I'm the Illinois OFR Program Coordinator, hired through the CDC Foundation and embedded within IDPH. I'd like to start off by explaining what an OFR is. So OFR stands for an Overdose Fatality Review. This is comprised of a multidisciplinary team of professionals working to identify patterns, risk factors, and systemic gaps that contribute to overdose fatalities. The team structure itself, as depicted in the diagram, can be seen as having central members of the team, such as an OFR coordinator, a data manager, and a facilitator for the meeting. These three roles can either be served by three different people or by one person, depending upon the team size. There are also peripheral members within the team that serve a full-time job within other organizations. So these people could be from the medical examiner's office or the coroner's office, the local health department, the EMS or law enforcement offices, or even from the judiciary, like in the drug courts or the prosecutor's office. There may also be members from the local healthcare systems, such as healthcare providers, mental health care providers, or pharmacists. Certain meetings may have guest team members from relevant organizations such as Child and Family Services, the Board of Education, school superintendents, or from nonprofits and third-party organizations serving the community, such as harm reduction and overdose prevention services. Some of the objectives of an OFR are to understand the full story. So by reviewing individual overdose deaths or specific decedents due to overdose, an OFR team can identify the missed opportunities for intervention where those individuals who died had interacted with their relevant agencies. Because all the team members are from the community, all the solutions made during the meetings are community specific. So these are more targeted and effective overdose prevention strategies. And the main benefit of an OFR is fostering collaboration. So you get a cross-sectoral teamwork that fosters holistic approaches to overdose prevention. This is especially key when looking at certain organizations that may not have a daily interaction with others at the team meetings. A good example of this is that a coroner's office and law enforcement offices may have daily interactions, but the local health department doesn't necessarily have that same kind of rapport with the law enforcement agencies. And so having an OFR where two representatives from each organization sit across from the table from each other at a regular interval provides an opportunity for them to open channels of communication and to understand each other's protocols and guidelines much better. These images depicted in the slide are example timelines from Cuyahoga County's OFR team. The top image shows the rough timeline for planning an OFR meeting and how the data is stored and recommendations are implemented. So 6 weeks prior to the meeting, the OFR coordinator will choose cases and send the identified information to those organizations within the OFR that have a data sharing agreement with them. Those agencies will then look back into their databases or speak to relevant staff members to see if and how many interactions were there between the decedent and their organization, and then send those incidents to the OFR coordinator, who then compiles a timeline. And this is about 2 weeks prior to the meeting. 1 week prior to the meeting, the OFR coordinator will create a concise PowerPoint presentation, prepare for the meeting, send out any notes or information if they want to have the attendees aware of the information beforehand, and share confidentiality agreements for them to sign. The meetings itself average usually between 1 and 2 hours and may review 2 to 4 cases. And this is where the recommendations come as a result of, looking deeply into the individual timelines and then analyzing all the different information points and having open discussion across the table. Then those recommendations then are compiled by the OFR coordinator. 1 week after the meeting, there is a debrief with the subcommittee team, and they may share the meeting details with the governing committee as well. There is a OFR data system called RedCap, which I'll get into later. But the OFR coordinator can then upload de-identified information into the data storage base. During the meeting itself, all information about the decedent shared is de-identified. Only the people who have a data sharing agreement and had that information shared with them from the OFR coordinator will know who the decedent is. The lower image is an example of that compiled timeline I was talking about. So here you can see different color-coded incidents on the timeline, and each one will be from a different organization. So you'll see light blue is DCFS, dark blue is law enforcement, and you can see that there are histories of prior overdoses, of arrests, of child abuse or victim of neglect, that their older brother had died of an overdose, and you kind of start seeing that there's a history leading them to using substances, or a history of substance use within their family, and that opens up a different, more nuanced conversation for, how do we prevent these overdoses from happening. So this is RedCap. This is a secure web-based tool developed for creating and administrating online surveys and databases. It can gather pretty much any kind of data in various settings, and IIR, or the Intergovernmental Institute of Research, hosts a server on a national level for any county or local jurisdiction to put their OFR data into their system free of cost. And you can scan the QR code here if you'd like to learn more about the RedCap system and how to use it. So within Illinois, we have a good amount of interest in OFR development already underway. I started this role as the OFR Program coordinator back in January of 2024. And at the time, we only had one known OFR in Kendall County. Through subsequent waves of outreach through email, I did find that there was another team running in DuPage. So those two have been the most active teams that have been helping to recruit others. We have two new teams that are starting this year in Winnebago County and King County. Each team is different in its own way. So Kendall County meets semi-annually because they only have 1 or 2 overdose cases per year now. It was a lot more frequent before, but they're looking to expand their team into a suicide fatality review, just to increase the relevancy and make sure that the meetings are meaningful for their team members. The team in DuPage, however, meets every 2 months, and they'll rotate one OFR case review meeting with a data analysis meeting, so they can sort of digest some of the information. And they'll review about 2 to 3 cases per meeting. There's a lot of interest across the state as well, and more than likely there's a county somewhere nearby you that is also either interested or developing a team. There is OFR activity across this country. There's 3 different models that states have sort of settled on for OFR structure. The most common by far is a decentralized model where individual counties each have their own separate OFR team. But for states that have a smaller population, they may have opted for a state level OFR that oversees the entire population, or even a hybrid model where some counties may have a separate OFR team, but the rest of the state has just one state level OFR, like with Nebraska. Douglas County with Omaha has its own team, but the rest of the state is covered by the state OFR. Legislation for OFR has been developing in certain states. So all the states in pink currently have OFR written into their legislations. Illinois is not one of them as of yet, but that doesn't mean that OFRs are impossible to run. New York actually has more than 20 OFR teams running, and they do not have active legislation, but it does make it easier because it makes the OFR a recognized public health authority with the who is authorized to access data from other organizations. So that just really streamlines the data sharing agreement process. This slide shows some of the data sources that are available for OFR case reviews. So the first resource I would recommend is the IDPH opioid data dashboard. After that, there's the statewide unintentional drug overdose reporting system, or SUDRS. This is collected through Northwestern, and the data comes from coroner and ME reports from across the state. from participating counties. The only caveat to this is it does not include suicide by overdose cases. It is explicitly for unintentional deaths. If you want to track suicides due to overdose, you would have to use the Illinois Violent Death Reporting System, or IVDRS. This tracks homicide and suicides, including those due to overdose. NEMSIS has the state naloxone dashboard, and this can provide county and zip code specific maps of abnormal naloxone related activations, or when EMS is called to deliver naloxone. ODMAP, or Overdose Detections Mapping Application Program, is a heat map that tracks fatal, non-fatal overdoses almost with pinpoint accuracy. It has overlays of all the transit lines within Chicago and throughout the state, all the different highways and rest stops. It can get down to general area specificity. So if you see that there's a spike or increase in overdose reports in a certain location, such as a local business or a specific zip code or a community or a school, that really helps with case selection and theming your case reviews, either by a certain zip code, or if you want to theme it according to like adolescents who experience overdoses, or homeless populations that have a spike of overdoses. Then your meetings can be themed in such a way. For social determinants of health data, the ORS Overdose Fatality Review Equity Tool is a really great platform. The Places platform, which is not listed here, is also a really great resource. The Illinois PDMP, or Prescription Drug Management Program, is currently accessible to 14 coroners and the ME in Cook County. We are holding discussions with them to see if we can get that access to all coroners. And they did say that is possible, so I'm hopeful that that will roll out sometime soon. Locally, also, there are a lot of different records that can be used, like public records, press reports, social media accounts for the decedent. These also help in finding next of kin, oftentimes, and there are some teams that actually use like GoFundMe pages to find next of kin. Law enforcement reports and records, your coroner's reports, school records. Next of kin interviews are kind of the gold standard for OFRs, because here you get a lot of information, detailed information about the decedents, especially like childhood or adolescence, that you wouldn't get from reports from organizations and agencies. And oftentimes OFRs don't have access to medical and mental health records, so a next of kin interview can really fill in the gaps. I mentioned earlier that one of the Illinois OFRs was looking to combine their OFR with a suicide fatality review. This is what that is. So a suicide fatality review is very similar to an overdose fatality review in terms of team members, meeting structure, and functionality, except that instead of looking at overdose deaths, you'll be looking at suicides. And it can be a suicide due to any cause. So this will, again, identify service gaps and trends in suicide cases and generate insights for policy development, education, preventative interventions like programs that team members would like to see implemented in their communities. The difference here is, instead of a next of kin interview, what a suicide fatality review has is called a psychological autopsy. And it's very similar, but it delves a lot deeper into the decedent's psyche, their thought processes and behaviors in the time leading up to their death. So from some of the discussions of suicide fatality review, there have been certain reports and studies that have been done. One case report from Oregon showed that they found that decedents tended to give away their pets in the days leading before their death, either to family members and friends or to pet shelters. And so they decided to post the suicide hotline within all the pet shelters in their community. Another one found that firearm suicides amongst youth had a tendency to allow their game character in game to die by suicide. This was a tendency that was, in combination with other signs such as like declining grades or alcohol consumption, could show that this child is at risk for possibly committing suicide. If you're interested in having an OFR started in your community, IDPH can help. We have some of the best practices expertise and technical assistance opportunities to help you in that development process. So starting right from team development and meeting initiation, we have a lot of samples and templates for data user agreements, memorandums of understanding, data sharing agreements, confidentiality agreements. We also have recruitment letters, like sample templates that you might want to use, or potential OFR team member or rosters. So like, who could you reach out to be part of your OFR? If you'd like to combine an OFR and a suicide fatality review team, we have connections within other states such as Ohio that are already doing that. There's training for next of kin interviewing. There's some lovely social workers from Milwaukee County and the MEO's office that are doing that work, that can provide a training session on what their best practices are. There's also training for using OD map data to develop case criteria or narrow down themes for your meetings. And then providing connections and networking for any of your recommendation implementation. So if you have recommendations coming from your meetings and you're having trouble figuring out how you want to get this implemented, we can provide those connections with nonprofits and third-party organizations that do that work already. OFRs are incredibly flexible, right from who's sitting at the table to how many people are at the table. The team structure depends entirely on your county and community needs. The data on the decedent cases may not be 100% complete according to whatever you think that you should have, but it doesn't have to be. You can still have a rich discussion and get impactful recommendations to implement from available case informations. The important part is just starting, not being perfect at the start. Start where you are, use what you have, and do what you can. Thank you so much for listening.